Hi, this is U.S. Senator Chris Murphy. I want to congratulate the Connecticut Behavioral Health Partnership and the Consumer and Family Advisory Subcommittee on their first annual iCAN conference. I'm sorry that I can't be there with you in person, but I wanted to send my thanks and my regards. I hope you have a really fantastic conference today because you're talking about maybe one of the most important topics that we discuss in Connecticut. That's making sure that clients and providers within the behavioral health care community are connected in a way that makes sure that we're doing service to Connecticut's recovery-based model of behavioral health provision. I've been focused on the question of increasing supports for Connecticut's behavioral health system since I was in the state legislature. As one of the authors of Connecticut's Behavioral Health Partnership and then the chairman of the committee that oversaw the implementation of that new program, I'm really proud about the gains that have been achieved in Connecticut because of it. But we still know that there are way too many people who are receiving mental health services throughout Connecticut that feel disconnected from the system, that feel like they aren't in charge of their care. And we know that recovery can only come through individuals feeling that personal connection to their treatment plan. And that's what you're going to talk about here today, what you can do at the state level to make sure that patients and families and providers, hospitals, outpatient facilities are talking to each other. I'm hopeful that work that I'm engaged in at the federal level can help this work at the state level. As many of you know, I've introduced a bipartisan piece of comprehensive mental health reform legislation, the Mental Health Reform Act of 2015. It starts by trying to increase resources for both outpatient and inpatient care to make sure that we have enough places for people to go, enough clinical spots for the people that need help. Then it tries to attack the discrimination still endemic within our system by putting more pressure on the insurance companies to step up to the plate and really enforce parity. Parity is a law that says insurers have to cover mental health just like they have to cover all of your other healthcare needs, but in reality it's not working because the insurance companies are putting up big barriers to receiving that care. Our legislation addresses that as well. And then we talk about this issue of coordination as well. We talk about making sure that mental health programming is connected with physical health and primary care programming so that a primary care doctor is in close collaboration with the behavioral health clinicians who are serving clients all over the state. We have new programs to try to get the two sides to talk to each other. And then finally, we have new workforce training programs in our bill that would train everyone from psychiatrists down to peer counselors to make sure that we have a pipeline of ready, willing, and qualified providers throughout the state and throughout the nation. I'm really looking forward to working with all of you on this legislation, a bipartisan piece of legislation that comprehensively reforms and improves our nation's behavioral health system. And I'm really looking forward to hearing about the progress that you're going to make in your conference today and looking forward to having it educate the work that we're doing down here in Washington. I'm sorry that I can't be there with you in person. I'm so excited to hear how it goes and look forward to working with you well into the future.